Welcome back. Today is November 11th, 2019, and today's program is going to be how do you pick a doctor for your services? How do you pick somebody when you show up to an office or before you go? Like everything I do, I like to introduce myself. I'm Dr. LADO. I am a board-certified psychiatrist in the state of Florida. My training and background is rather unique in how I got here, but it's always important to mention. First, I became a pharmacist, and that helped a great deal in treatment for patients. That took me afterwards to a 1 year of surgery, which was a very interesting career because there we could see the disease either through x-rays, through physical exam. And after that 1 year, I went into psychiatry. Interesting enough, psychiatry is a profession that's still evolving. Even after hundreds of years, we have to depend on one simple thing: how we relate to the patient. How do we understand the patient and what the patient tells you? And the reason I'm telling you this is because it's very important how you select a doctor that's good for you. There's so many ways of doing it. But first, let me tell you about how important that is. One of the key elements in a psychiatric interview or any kind of interview is this relationship you have with your patient. Like any relationship you have in this world, you have to have a certain level of trust and comfort, and that's key. Because you see, no matter whether you go to a psychiatrist or you go to a surgeon, there has to be this psychological therapeutic alliance. As I mentioned to you before, if you truly trust the person that you're treating is treating you, you will be more receptive to treatment. So let me tell you why it's very difficult to choose somebody. First, take into mind, if you're looking for a doctor to treat you, it's either because you were referred by somebody else, like your primary care doctor, or you simply realize something is not right, or perhaps family. Interesting enough, in my profession, some of the patients that I see come as a result of family intervention. You know, people think that family intervention will help, but that's not the case. There are three important elements in any treatment and therapeutic alliance. Number one, you have to admit you have a disease. If you don't admit you have a disease, then you're in trouble. We call that denial in medicine. Once you accept that you have an illness, then there has to be something inside of you that says you have a willingness to change, and that is so critical. Remember, I spoke to you about the placebo effect, which will be a topic later on, but your mind and your state of emotion plays a critical role in healing. You probably have heard of cases of people who have survived cancer treatment, and one of the key things that they have in their mind is the willingness to endure, and they know they want to survive. It is no guarantee that this emotional state will help you, but at least you will have something on your side, your faith in yourself, that you can get better. So why is this important? And I'll tell you why. Well, nowadays, in the older days, the only way you can figure out who can treat you or who you can be referred to is usually by another doctor. We rarely question the profession, and also we rarely question how good that person was. We didn't have many choices. Now, if you were smart, the first thing you do is you check the State Department of Medicine for that place. The State Department of Medicine has very accurate records as to if you're capable of practicing medicine. A person can say to you, this is a horrible doctor, but that information you can obtain from the Board of Medicine. It is not enough, however. Nowadays, there's a whole new way of finding a doctor. Right? Now we use review sites. These review sites have plus and minuses. You know, I have a lot of experience with review sites. In my profession, patients have all kinds of problems, including personality issues. On very rare occasions, I may get a patient who wants something which I realize is not in their best interest. And obviously, when they get very angry that they don't get what they want. For example, if a patient wants them to take alprazolam, a very commonly used sedative, but it's highly addictive, and I don't think this is in the best interest in the patient will get angry and walk out, and the next thing you see is a negative review. Sometimes more than you were expecting. So these review boards, these review sites that you see, this is how you select a doctor. Now you got to remember that these review sites also have some monetary interest. They advertise and they make money. And some of these review sites may not have really good integrity. I have been victim of some of these sites, and basically what they say is, unless you pay us money, we will not do anything with you. We will not review anything negative. And that's okay, because now there's new laws to protect people from bullying and negative ratings and negative information, which is not really truthful. They're not around as much anymore. But I always say, if you go to a doctor's website, not a doctor's website, a review site, and there are many of them out there, there's Health Grades, there's many. I don't look at the positive reviews to select a doctor. I look at the negative review. You see, the negative reviews, if the doctor answers back to that negative review, he's not hiding. He's being sincere and honest, Often this profession comes with a price. Just because we're highly educated and we're well trained, it doesn't mean that we don't make mistakes. We all make mistakes. And sometimes we have to own up to our mistakes, and we have to be truthful to the patient that you have made a mistake. But the fact that the doctor has answered that question and he was very sincere about it, it's a good sign. The best way to know a doctor if he's practicing good medicine is sometimes word of mouth. People who've been there, they'll tell you about the doctor. Once you select this doctor and you decide this doctor is best for you, then you come face to face with that doctor. In my field, you have to remember, psychiatry does not have many tools like other specialties. The most important way that we make diagnosis, by the way, in order for us psychiatrists to provide good treatment, you must have 3 or 4 elements. Number one, an accurate diagnosis. Very challenging for us because we cannot put an MRI in your brain. We cannot do certain things. Even though there's a lot of technology that will help validate your diagnosis, it is not established instruments like the MRI, or what we call the positron emission tomography, or even the electroencephalogram to give you the most accurate diagnosis of the patient. So what does it depend on? It depends on 85% on the history that you give to the doctor. This history is extremely valuable. Now, there are many ways to obtain a history. In my practice, we're a little bit different because we realize that an hour or 2-hour interview will not be enough to gather a lot of information. You could be a great diagnostician, but you still will miss some things. So many people employ all kinds of instruments. In my practice, because we employ various instruments before the patient sees me. And the reason I do this, and I think it's very good, is because if you provide information before you see the doctor in a calm way in your home, written or typed, or even not in the face-to-face, you tend to be more open and more sincere. There are some tests that you can take prior to seeing the doctor in which you actually open up, and that helps with the information. Remember, 85% of the diagnosis that we make, in fact, the book that we use, it's called the DSM-5, is basically the book that we've been trained to use to make diagnoses. The rest of the diagnosis is about 10%. 10% of the diagnosis is face-to-face. This face-to-face interaction that we have with the patient is very important because that's what we call mental status. We can observe a person's behavior, we can see how they talk, conversation, thinking, and sometimes specialized memory tests will tell us how the brain is functioning. Remember, being a board-certified neurologist and psychiatrist, remember, neurology deals with the hardware part of your brain, the hardwiring, how the brain is structured, how it functions. The psychiatry portion is the software, I like to call it that way. So mental status and history is extremely important. The most important thing in order for this to happen correctly, is you have to feel comfortable with the doctor to open up. Now, this is very challenging, especially in my profession, because people come very nervous and very anxious. So the key thing is that if the doctor ask you a few questions. For example, after you do the review sites and after you meet people and they tell you, so what makes your decision for a doctor? Number one, that the doctor, we come with intuition in this world. You're born with a sense of protection. This intuition that you have helps you. You have to trust your intuition. If you feel comfortable with that doctor and he makes you feel comfortable in that first engagement, you will open up and will be sincere. So trust is the most important key to any therapeutic alliance. I hope you enjoyed today's program, and I will talk more about some of these issues in the next one. But trust your instincts when you meet a doctor. A person who makes you feel comfortable, you always will open up to them and more sincere. But always remember, you have to first admit that you have a problem and you're willing to change. I'd like to thank you for the second episode of Mind Hijack. Please subscribe to the channel, and all your feedback is very important, because the more you tell me what you want to hear, the more I'm able to help you. Thank you, and have a good day.